Hi, welcome to my presentation on investigating the effects of virtual patients' nonsensical responses on users' facial expressions in mental health training scenarios. I'll be presenting this work with the help of a special guest, a virtual human called Mia.
Hi, I am Mia, a virtual human. I'm here to support Dr. Alex with the presentation. I'll try not to give any nonsensical responses today.
Researchers have investigated the use of virtual humans to facilitate discussions of difficult topics that are stigmatized or uncomfortable. In previous studies, virtual humans have been applied to discuss topics such as PTSD with service members, colorectal cancer prevention with the public, and mental health topics with patients. An increasingly common use of virtual humans is for training social skills needed for interpersonal interactions in diverse social settings. Success of such approaches are partially due to the fact that people tend to treat computers as social actors, often expecting virtual humans' responses to be similar to those from real humans. Others have noted that virtual humans empowered by natural language processing may often fail to answer users' questions, or they may give nonsensical responses. In previous works studying virtual humans in training simulations have mostly focused on errorless virtual humans. Our virtual human-based system has been reused and modified to conform to different requirements and applications by different groups of users, developers, and researchers, which made it prone to responding with nonsensical responses. In this paper, we focused on the effects of the virtual human's verbal communication errors during conversations. We investigated how clinician participants reacted to virtual patients' sensical versus nonsensical responses in the context of a larger project that aims to help clinicians acquire empathetic skills toward patients with symptoms of the suicide crisis syndrome, a condition associated with imminent suicidal behavior. Here are some examples of nonsensical responses. I'll have a little chat with Mia, and she will give me, on purpose, some nonsensical responses. So Mia, what's your medical history?
I am Cynthia.
Have you taken any risks lately?
I take something for my thyroid, and I'm on birth control.
In this research, we did not use Mia. Clinicians with desktops or laptops interviewed two virtual humans, Bernie and Cynthia, while their facial expressions were recorded. We analyzed the participants' facial affective behaviors in reaction to the virtual human's responses at three distinct 10-second moments during their interaction with the virtual humans. One at baseline, immediately after the virtual human provides a sensical response to an empathetic opportunity. Two, immediately after the last nonsensical response. And three, after the virtual human's sensical response that immediately followed a nonsensical one. Empathetic opportunities are critical moments during an interview when patients directly or clearly express their emotions, progress, or challenges to their interviewing clinician. We analyzed the clinician's facial expressions to extract their facial affective behaviors using the Noldus FaceReader tool. We classified their facial expressions as angry, disgusted, happy, neutral, sad, scared, and surprised, and grouped them as negative facial affective behaviors and positive facial affective behaviors. We hypothesized that one, nonsensical responses would elicit an increase in the percentage of time participants spend demonstrating negative facial affective behaviors compared to the baseline response, and that there would be a reduction in negative facial affect behaviors in the sensical responses immediately after the nonsensical ones. We had access to data from 20 participants, 13 males and 7 females. After removing participants that did not meet our selection criteria, that involved choosing only participants that interacted by speaking instead of typing and that received nonsensical responses in the relevant pattern, 10 participants remained. 8 participants were males and 2 participants were females. Participants' ages ranged from 27 to 46 with an average of 31.8. All participants were clinicians who had active patient loads and reported having no prior experience with virtual human training systems. The results we obtained in analysis 1, comparing the percentage of time participants demonstrated negative facial affective behaviors between the nonsensical and baseline moments, support our hypothesis that nonsensical responses would elicit an increase in the percent of time participants spent demonstrating those negative facial affective behaviors compared to the baseline response. In analysis 2, we hypothesized that there would be a reduction in the negative facial affective behaviors in the sensical responses immediately after the nonsensical ones. The difference observed was not significant. However, we did observe a corresponding trend supporting this hypothesis. The mean percent of time demonstrating negative facial affective behaviors after the nonsensical response was greater than after the sensical response that immediately followed the nonsensical one. Regarding positive facial affective behaviors, we observed a statistically significant increase in those positive facial affective behaviors after sensical responses that immediately followed nonsensical ones, indicating that the sensical response may have effectively counteracted the effects of the nonsensical responses. Virtual human-based systems have become sophisticated and their adoption continues to increase. Virtual human systems are oftentimes reused and modified to conform to new requirements and applications, often by different groups of users, developers, and researchers. In this context, dialogue systems may grow in complexity and become prone to errors such as generating nonsensical responses, hence the importance of this work. Our virtual human-based system had been reused and modified to conform to different requirements and applications by different groups of users, developers, and researchers. We presented our analysis of positive and negative facial expressions of users interacting with this virtual human-based system that provided nonsensical responses during their interaction. Taken together, the results show that nonsensical responses from virtual humans may lead to an increased percentage of time participants demonstrate negative facial affective behaviors during their interaction with the virtual humans. These are preliminary results focused on facial expression analysis. However, they suggest that virtual human researchers and practitioners need to consider the potentially wide-ranging practical implications of nonsensical responses and other technological failures in general. To the extent that facial expressions may be superficial evidence of deeper perceptions and emotions, it is plausible to consider that nonsensical responses by virtual humans may lead to an effect similar to breaks in presence. In virtual reality, breaks in presence are moments in which users are reminded that the virtual world is not real, which can also reduce users' performance in training simulations. And this is something that we wish to investigate in future work. More information about this research can be found in our paper. Thank you.